Welcome to the Masterclass today. My name is Dr. Jinhee Park, and I'm going to present to you a doctor's guide to holistically healing low back pain without drugs or surgery, the 5 shifts to a pain-free active lifestyle. So before we start, I just want to remind you to silence your mobile devices and close all the other web browsers to fully focus on listening to this presentation. And you may want to prepare a notepad and a pen to take some good notes, since I have a lot of helpful information to share with you. So let's dive in. So who is this presentation for? This is for high-achieving professionals who have low back pain that has lasted for more than 3 months, that is debilitating, who otherwise had been healthy and active before, who have a diagnosis of lumbar strain, degenerative disc disease, herniated disc, a ruptured disc, sacroiliac joint arthritis, or of a non-specific cause. People who are not getting better with pharmaceuticals such as narcotics, non-steroidal anti-inflammatory drugs, muscle relaxants, antidepressants, epidural steroid injections, physical therapy, chiropractic therapy sessions, or self-implemented exercises. People who are frustrated with the conventional medical system, and people who want to avoid back surgery by all means, and people who have a strong desire to get back into a healthy, pain-free, and active lifestyle. So in the next 60 minutes, you will learn why you can fully recover from your low back pain injury, even if your doctors have told you otherwise and have put you on a cocktail of pain meds. How to be able to get back into doing your favorite activities, such as playing sports, traveling long distances, going to the movies and restaurants with family and friends, totally pain-free, and having the mobility and flexibility without pharmaceuticals of back surgery. You'll also learn what most doctors don't tell you about chronic low back pain and the Western medicine's wrong approach to treating low back pain, why pharmaceuticals, steroid injections, and back surgeries don't work for long-term health. And you'll also learn the real fundamental causes of chronic low back pain, the long-term morbid consequences of not treating low back pain properly, the body's innate ability to heal itself with a proper holistic treatment, and the comprehensive approach to healing that is necessary in order to achieve the full recovery. So ultimately, my promise to you is that I will give you a step-by-step strategy for holistic healing of low back pain towards a healthy, pain-free, and fully functional and active life. But before we get into all the good stuff, let me check in with you to quickly see where you're at. Does it sound like you? Are you tired of not being able to do the things you used to be able to do because of the debilitating low back pain? Do you feel so old for your actual age and feel your life has become so limited due to your low back pain? Do you secretly isolate yourself and avoid normal social activities and hobbies with family, friends, and work colleagues due to the fear of pain attacks? And are you sick of relying on painkiller medicines, injections, chiropractic adjustments, massage that only give temporary pain relief but don't give long-lasting health? Are you discouraged from hearing the negative opinions of your doctors that you will only get worse and that there's no chance of recovering from your current condition? Are you scared that you may have to undergo back surgery when you hear all the horror stories from people who have already gone through back surgery and are still in debilitating pain and with limited mobility? Do you feel that you are doomed to live sedentary and crippled for the rest of your life just dealing with this low back pain? If this is how you feel, I have good news for you. So none of these things are the problem. The real problem is that you haven't made what I call the shifts to holistically healing your low back pain. And I'm going to tell you what those shifts are in just a moment. Once you make these shifts, you'll be able to get back hope, confidence, and belief that there is a way out of this struggle. And you'll be able to prime your body to induce the positive physiological and biochemical changes towards healing in a holistic and non-invasive way. And you'll be able to get back into a healthy, pain-free, active life, doing all your favorite activities, such as participating in social events and being fully productive at your work. And you will regain so much more energy and zest for life with better mood, improved relationships. And you'll be able to wean off of pain meds and pain management procedures and prevent from having to get unnecessary back surgery because your body will not need them anymore. And you'll be able to stop wasting money and time on going to doctors, physical therapists, chiropractors who only hand out Band-Aids or incomplete temporary pain relief without giving you a fundamental solution. And as a result, you will avoid all the long-term toxic side effects and complications from using pain pills, procedures, and undergoing surgeries. So the one thing you need to know are the simple 5 shifts you need to make to holistically heal your low back pain and get back into a pain-free, active, healthy life. And I will walk you through exactly how to make those 5 shifts today. But before we go too much further, let me take a second to introduce myself so that you know who I am and why the hell you should listen to me. So my name is Dr. Jinhee Park, and I'm an integrative medicine physician with medical training and clinical experience since 2006. In addition to getting trained in Western medicine at UC Davis Medical School and University of Southern California Family Medicine Residency Program, I was also trained in traditional Chinese acupuncture and Chinese herbal medicine, and I also worked as a certified medical acupuncturist. I've also been trained to become a certified personal trainer through the National Academy of Sports Medicine after I was able to lose 55 pounds being trained by a personal trainer and get into the best shape of my life, being able to run marathons and feel very healthy. I've also spent about a year undergoing a very intensive yoga teacher training and became a Yoga Alliance certified yoga teacher. And currently I'm going through the Integrative Medicine Fellowship at University of Arizona, being trained under the integrative medicine guru, Dr. Andrew Weil, along with 100 other physicians from all around the world, really focused on maximizing patient care through holistic healing. So I wanted to introduce to you my story, how I discovered these fundamentals of holistically healing low back pain, because I myself suffered from a chronic low back injury for 2 years from a work-related low back injury. So this was during residency training. I was working in the hospital in downtown LA, and I was really working hard, getting up in the middle of the night, delivering a lot of babies and lifting up heavy patients. And I didn't really realize how much I was hurting myself until one day I was standing up and I felt this very excruciating low back spasm, which took away all the strength in my lower extremities, and I just collapsed on the floor in the middle of the hospital. And I had this intense involuntary muscle spasm all entire my back, which made me just be in agony the whole time. And it really caused a big incident. But anyways, as a result, I went to see a Western medicine doctor, and they did an MRI, which showed that I had a severe degenerative disc disease and a herniated disc at L4, L5. And he told me that my back condition was so serious and irreversible, which made me feel so depressed and fall into despair. So after futile attempts to get healed through Western medicine, taking pills and getting injections, I sought out integrative medicine modalities. So I studied Chinese medicine, personal training, holistic nutrition, and yoga to figure out a way to heal my low back pain without having to get surgery. And after practicing the healing modalities that I've learned, I was able to heal my low back pain and get back into a previously healthy and fully pain-free active life, running, dancing, and bicycling and traveling all around the world. And I realized that my body has the innate healing capacity given the right mindset, nutrition, nudge of structural alignment with gentle exercises and herbal supplementation in a consistent manner. So I went from feeling like a 99-year-old fragile old lady, bedridden most of the time and being dysfunctional, to being able to climb the 26-mile Inca Trail on the Mount Andes towards Machu Picchu in Peru. So this was a picture in November 2016 when I finally realized that I had fully recovered from my low back injury. And I was in the best shape of my life. I no longer have to rely on pain medicines. And now I feel like I'm 25 years old, so invigorated, even though I'm almost 40 years old. So with the healing system I developed, I noticed that there are so many other people dealing with chronic low back pain, and they're not treating it properly. Especially, I've worked as a traveling physician in California, visiting Medicare patients at their homes. And a lot of those people who had been injured in their low back earlier in their lives, they were misled into getting back surgery, and as a result, they were living with so much regret, staying on painkiller medicines, being disabled for the rest of their lives, walking only with a walker and being on a wheelchair and being very sedentary and living with so much depression. So that's when I realized that I wanted to help others with similar chronic low back pain issues get healed without medications or surgery. So that's how I became an online health coach, doing this health coaching business. So it is my mission in life to help people holistically heal their low back pain and wean off of medications and prevent from having back surgery. So coming back to discovering the 5 shifts. So I have seen thousands of low back pain patients during my career so far, and there were people who fully recovered from their misfortune in a matter of few weeks or months, whereas there were people who continued to live with low back pain and suffer for the rest of their lives. And for those who were able to recover and regain their health, I have discovered that there were 5 shifts that these people were making that most others who were still struggling were not making. So there are the 5 shifts in your beliefs you must make to holistically heal your low back pain and get back into an active, healthy life. And I'm going to walk you through the 5 shifts on this session. So shift number 1 is that your body is designed to heal itself. So this is all about the mindset about chronic low back pain. So the conventional myth is that most people think that chronic low back pain is a mechanical problem that can't be fixed entirely unless you have back surgery. But our body is an organic being constantly going through regeneration of new cells. So even if there's a damage or misalignment of the spine, it can be naturally corrected through non-invasive holistic treatments. As long as you have a working brain, heart, liver, kidneys, and blood vessels that bring blood to the body tissues, your body has the innate capability to heal itself. But it all starts in your subconscious mind. So I wanted to reiterate the power of the subconscious mind. Subconscious mind is the belief that one has. And this belief controls your body, your hormones, your body metabolism, and microcellular activity. So as Henry Ford says, whether you think you can or you can't, you are correct. So when you live in a victim mindset, thinking that you're helpless and you believe that things will never get better, that will become your reality, because all that negativity will propagate a release of stress hormones, which impedes with healing, and your body is unable to make the physiological changes that would induce healing. Whereas if you visualize the end result you want, which is the active, pain-free, healthy state, you will cause positive physiological changes and biochemical changes in your body that would lead to healing. And it really doesn't matter what kind of diagnosis you had. It really doesn't matter. So see your life as you wish it to be, not as it currently is, and make this as a daily meditative prayer habit. So take about 10 minutes every day being in a relaxed position and focus on the thought that your subconscious mind is filled with thoughts that you have perfect health and active lifestyle, and nurture this firm belief that you can get better as long as you follow proper guidance. The problem is that modern medicine focuses heavily on medical imaging studies such as the MRI, CT scans, and the old way of thinking is that many people think that when they see the MRI, which shows a herniated disc or degenerative disc disease, ruptured disc, then they start to label themselves as the diagnosis for the rest of their lives. This becomes a dark, limiting belief that impedes them from showing up to life as their best self. And unfortunately, they use this as a negative stigma throughout their lives and begin to believe that they will never get better. But in fact, many research studies have shown that 50% of the people who didn't have any clinical symptoms of low back pain, who underwent an imaging study for other reasons, were incidentally found to have structural abnormalities on the imaging results. Isn't that funny? And on the other hand, 50% of the people with chronic low back pain were found to have structurally normal imaging studies. So their imaging studies were negative. So this indicates that the structural abnormalities seen on the imaging studies don't always correlate with the source or the degree of the pain. And even if it does, even if there is a structural abnormality that's causing pain, it can be corrected non-invasively with proper lifestyle changes. So I want you to make sure that you don't get discouraged by your previous conventional medical doctors who told you that your current condition is permanent, and don't buy into their negativity. There may be some old-fashioned doctors like this guy here, but I want you to keep your head up high and have faith that this pain condition is only temporary, and that with the right guidance and resources that you can get healed and become active again. So I wanted to tell you about Paula. Paula is my former health coaching client. She was a retired corporate professional. She came to me and she said, I suffer from low back pain for about 2+ years, and she had insurance with Kaiser. So she went to her conventional medical doctors who did an MRI, and she said, I was diagnosed with multi-level degenerative disc disease and spondylolisthesis at L4 and L5. So spondylolisthesis is a condition where your spine is vertebra are misaligned, so that can cause irritation to the adjacent nerves, which can lead to muscle spasms and a lot of pain. So when I heard about this diagnosis, my neurologist, when I heard about this diagnosis by my neurologist, I was so scared that I was going to live with a disability for the rest of my life. So in August 2015, I was almost immobile and in a wheelchair, walking with a cane and using back braces and having to take multiple painkiller medicines. I didn't want to get back surgery. So she came to work with me, and we worked on shifting her belief about her condition. So afterwards, she said, I seldom use the cane or back brace now, and I can walk 4 miles a day with my dogs. And I lost 15 pounds in the past 2.5 months, which has helped me lessen my burden in my low back. And the home therapy diet herbs prescribed by Dr. Park has helped me get stronger and pain-free, and I've been weaning off of my pain medicines. So compared to where I started, I'm feeling so much better. So you could see that she's recovered so well. This is a picture from a few months ago after she worked with me. She's standing and she's walking really with a happy face. This is actually at her daughter's wedding. So she's fully recovered now, and it's such a successful story that I wanted to share with you. So shift number 2 is healing involves an active process. So the old way of thinking is that most people think that healing is a passive process where receiving some pill, procedure, or surgery by a doctor will magically take away the pain instantly. So therefore, they think of themselves as the victim who can only find healing from external resources, and think that without those things, they will continue to live with the pain. And they blame the doctor for not giving the right pill, right procedure, or right surgery if they are suffering from pain. However, the new way of thinking is that actually healing involves an active involvement of the patient herself with an overall shift in the everyday lifestyle. So adopting healthy habits of what she puts into her mind and body will remove the chronic stressors and prime the body for self-healing. So it is really important to have consistent implementation of the healthy habits to lead to holistic healing. And therefore, patient is not a victim of her circumstance, but has total control over health outcome. So, for example, herniated disc is one of the most common conditions that people have, which they think is causing their low back pain. So many people think that if you have a lumbar herniated disc, that would automatically lead to pain symptoms. But that is not always the case. The MRI research studies have shown that many people who have an obvious disc herniation and yet are totally pain-free. For those people, the disc herniation is not a source of pain. The disc herniation can cause pain when the disc ruptures the outer layer of the disc called the annulus, allowing the soft gel-like center to ooze out to the intervertebral space. And this soft gel-like center is called the nucleus pulposus. And this herniated nucleus pulposus can pinch the nerve root, but it also contains inflammatory proteins that can cause enough inflammation to irritate the nearby nerves, which can cause muscle spasms, pain, and weakness in the lower extremities. And this is commonly known as sciatica or lumbar radiculopathy. So there are ways to make the herniated disc asymptomatic. So by sticking to an anti-inflammatory diet, you can reduce the hyperactive inflammation near the nerves. And by improving circulation to the low back tissues, the body can remove all the toxic lactic acid accumulated in the muscles from the spasms. And over time, your body will recognize the herniated portion of the disc as foreign material and dissolve it and remove the inflammatory proteins. In addition, the water contained in the herniated disc will be absorbed by the body, causing the herniated segment to shrink in size. And as the herniated portion of the disc shrinks, it may no longer affect the nearby nerve. In addition, through consistent core extension exercises, the symptomatic portion of the disc can be moved inward toward the disc and away from the spinal nerves, no longer causing any compression or irritation. So healing low back pain due to a herniated disc is a gradual process requiring consistent implementation of healthy diet, mind-body relaxation, core strengthening, and maintaining good posture. And this type of holistic healing is achievable if you do it the right way. So you need to understand that it's an active process, not a passive process. Many people who try to achieve a quick fix by undergoing back surgery can end up with complications such as infection, blood clot formation, scar tissue formation, and unexpected nerve damage, which can cause more pain symptoms and immobility down the road. So avoiding such passive process, such as surgery, is advised. So I want to introduce to you Ron. He's another health coaching client that I had in the past. So he was an education professional and also an author and a runner. He had injured his low back from an improper lifting of a heavy object, and he was diagnosed with lumbar strain for 4 months. He was living with so much pain that was very uncomfortable and nagging, which interfered with his career and relationships. So we worked on kind of shifting his beliefs about not having to rely on pain pills, but consistently getting into an active process of tackling the underlying root causes. So after working together for 12 weeks, here's the email he sent me, which is short and sweet. He said, "My low back pain has gotten so much better. Thank you." So this is another really cool success story that I've experienced. So shift number 3 is to stop applying Band-Aids and focus on eliminating the root causes of low back pain. So I wanted to share with you a story of ants from my childhood. So when I was 10 years old, I was living in this house with a big living room, and one day I noticed that there were these ants coming in through the crack of the window and forming a trail like this, crossing the floor and going underneath the sofa. And I was like, whoa, this is so disgusting. So I went to the convenience store and I bought this Raid insecticide, and I started spraying and killing the ants. Psst, psst, psst. I really wanted to kill all those ants. They did die when I sprayed it, but a few hours later when I came back, I noticed that there were other ants coming in and forming another trail nearby. So I kept on spraying more and more Raid insecticide. And I kept on spraying and spraying. But even when they died, it didn't totally eliminate all the ants. There were always other ants coming in and forming other trails towards the sofa. So after one week, I had to go back to the convenience store to buy another bottle of insecticide. And this time I used even more potent insecticide and kept on spraying. But nevertheless, the ants were still coming back. I would spray all the time, but the ants were still forming another trail and making a mess. I eventually got a broom and I started sweeping away the ants, hoping that that would deter the ants from coming back. But still, the ants were still coming, and I was only making a big mess. So one day, after a couple of weeks of doing this, I came back from school and I noticed that in the corner of the living room, my dear pet chick was found dead. And it turned out that chick was poisoned by all that Raid insecticide that I was spraying. But the ants were still coming back and still forming trails to go underneath the sofa. So at that point, I was so pissed off. I decided that I needed to really see what was underneath the sofa. So I got my sister and we moved the sofa away. And what we found was this piece of honey cracker with all this honey was attracting all these ants. And all these ants were mounting on top of that honey cracker. And it was forming a big ball like that. So I went to the kitchen and got a big washcloth. And I wiped away that honey cracker and wiped away all the honey. And a few minutes later, I noticed that there were no more ants coming in. And I no longer had to spray any more Raid insecticide, nor did I have to broom away those ants anymore. So the reason why I'm telling you this story is because it's such a great analogy of how Western medicine treats chronic low back pain. The ants are analogous to the symptoms of low back pain. And the rate insecticide is like painkiller medicines and pain management procedures. And brooming is like doing back surgery, which is a forceful way of treating the symptoms. And then the killing the pet chick it's kind of like the unforeseen side effects of using painkiller medicines. So this shows that you can spend your whole life spraying ants with Raid or brooming away the ants, but never be able to eradicate the ants because you never got to the root cause of the problem, which is the honey cracker, the root cause of low back pain. So there are 6 core root causes of chronic low back pain, which most doctors neglect and don't tell their patients. First root cause is chronic negative emotional stress, causing tension to low back muscles and causing a vicious pain cycle. So whenever there's negative emotions, that cause a lot of negative stress cortisol release, and that leads to muscle tension, and the muscle tension causes pressure on the nerves. And then the stress also causes the blood vessels to constrict, and there's reduced circulation, which causes muscle shortening, restrictive movement, a lot of stiffness. And then the trigger points are activated, and there's a lot of irritating waste caused by lactic acid accumulation, and that causes even more pain. So this becomes a very vicious cycle. The second core root cause is the biochemical stress, which is the systemic pro-inflammatory state of the body caused by poor nutrition. So in modern society, a lot of people eat a diet with lots of sugar and processed foods, and these unknowingly cause the body to be in a hyper-inflammatory state. So inflammation, when you have adequate amount of it, it's good for healing. But if you have too much inflammation all the time, your body's always in a constant damaging fight or flight state. So it causes more damage to your body than good. The third cause is liver and kidney qi deficiency. So this is the concept that I learned when I was studying Chinese medicine, Chinese herbal medicine. In Western medicine, the organ systems are all fragmented. So the orthopedic surgeon will only care about the musculoskeletal system. The GI doctor would only care about the liver and the GI system. The kidney doctors only care about the kidneys, as if they're all separate organ systems. But in fact, when you study Chinese medicine, there's such a very close interconnectedness between these organ systems. And it turns out that the musculoskeletal system is governed by the liver and kidneys. So if you have a chronic low back injury that's not getting better for more than 3 months, that indicates that there may be an underlying qi deficiency of the liver and kidney, which needs to be addressed through herbal supplementation. The fourth core root cause is blood stasis. So blood stasis is when there's not enough blood circulating to the injured tissues, so there's lack of oxygen and fresh nourishment to the damaged tissues. And when this happens, the tissues initiate a signal to the brain, which manifests as pain. The fifth core root cause is weak core muscles and lack of flexibility of the core, causing muscular imbalance. And then the sixth core root cause is chronic poor posture, causing misalignment of the spine. So these 6 underlying root causes need to be addressed, but instead Western medicine just focuses on blinding the person to the fact that they have a problem with a pill or procedure. So with a pill or procedure, you just merely temporarily cut off the pain signal to the brain without really tackling the underlying problem. So it's kind of like putting a Band-Aid on top of a deep wound. So you'll never know that the wound is there. But there are so many serious side effects of painkiller medicines. A lot of people, they get prescribed with all these pills. This is a picture of an average person over the age of 65 years old on medications, and really shows how sad our reality is in terms of treating chronic illnesses. People don't realize how devastating it could be to their health by just popping those pills in. For example, non-steroidal anti-inflammatory drugs such as ibuprofen, Advil, Aleve, naproxen, those drugs can cause severe kidney damage. So if you take those medications long term, it can lead to renal failure. And those nonsteroidal anti-inflammatory medications also cause stomach bleeding, which is also a serious side effect. The Tylenol, in other words, acetaminophen, is also commonly used painkiller medicine. And then when that's overdosed, that can cause liver damage. A lot of medications contain acetaminophen, such as like Norco, Percocet, Vicodin. They all have some acetaminophen. So if you overdose on that, then you're likely to have liver damage long term. And then a lot of opioids, such as like morphine, Dilaudid, hydrocodone, oxycodone. These affect the brainstem, and it really depresses the respiratory drive, so it causes you to stop breathing. So if you overdose on those medications, you can stop breathing and die. And a lot of those opioids are also called narcotics, and also muscle relaxants. They can all cause you to feel very sleepy. So it causes sedation, and also causes your brain to feel very foggy. So you can't really memorize. You can't remember things really well. And it facilitates dementia. So most of these painkiller medicines that people are on they're not effective in really treating the underlying problem, but they cause long-term, very, very serious side effects. So you have to really know that. And then the epidural steroid injections are another type of things that get recommended if the pills don't work. But unfortunately, this has also a lot of side effects. There's headaches, anxiety, decrease in immunity, stomach ulcers, arthritis, and cataracts. So unfortunately, a lot of people get talked into getting back surgery when other things don't help. But 95% of people undergoing back surgery regret having had the surgery because they either got worse or had no change in the clinical outcome. And many of them had to get repeat surgeries to fix a complication, which brings even more complications. So when I say complications, those are like a lot of scar tissue formation, blood clot formation, and then some of the surgeries involve putting in metal hardware such as screws and rods to stabilize the structure. But the thing is that after a few months or years down the road, that can be unexpectedly dislocated and cause major irritation of nerves and cause even more severe pain and even paralysis. And even the most skillful surgeons are not able to predict those kind of complications. So these people who went through surgery, they still suffer from lots of pain and need to rely on painkiller medicines for the rest of their lives. And they're still living a very limited, fearful, sedentary lifestyle. None of them were really recovered back to their original pain-free, fully active state. So this is based on what I've seen, seeing like thousands and thousands of Medicare patients over the age of 65 years old in my medical practice. And these are the comments that I've found from various back pain support groups. People who had back surgeries, they're complaining about how their life's ruined and they're living with so much regret. So I wanted to recap the 6 core root causes of chronic low back pain. Number 1 is chronic negative emotional stress causing tension to the low back muscles. Number 2 is biochemical stress, which is the systemic pro-inflammatory state caused by poor nutrition. Number 3 is the internal organ deficiency, meaning the liver and kidney qi deficiency. Number 4 is blood stasis, which leads to lack of oxygen and nourishment to the damaged tissues. Number 5 is the weak core muscles and lack of flexibility causing muscular imbalance. Number 5 is chronic poor posture causing misalignment of the spine. So all these 6 core root causes need to be addressed. So the new way of treating low back pain would be using non-invasive treatments to address these 6 core root causes of low back pain. So this diagram shows the 6 fundamentals of holistically healing low back pain and priming the body for self-healing for at least 12 weeks. So it takes about 12 weeks for the body to make some significant physiological biochemical changes that lead to significant improvement. So this is a fundamental natural healing transformation with a comprehensive approach. and it focuses on implementation of the simple lifestyle changes with mindset, nutrition, herbal supplementation, home therapy, exercise, and ergonomics. That leads to addressing the underlying causes of low back pain in a non-invasive and holistic way. And by doing that, they change the underlying biochemistry and physiology, which primes the body for self-healing. And this holistic healing involves a comprehensive approach. So if you were to sporadically do one or two things out of these six, it won't really bring in desired results because the results come from the synergy of multiple aspects of lifestyle changes. And if you go through this process for at least 12 weeks, you become well and healthy and pain-free with total biochemical transformation. And as a result, you no longer need to stay on those painkiller medicines or procedures, those band-aids anymore, because you will no longer have to, you'll no longer feel like you need them anymore. And as a result, you'll no longer have to expose your body to such detrimental toxins or complications. So I have another great successful case story. So I'd like to talk about another client, Fred. So he approached me in mid-August of 2017 through Facebook. He had been suffering from a debilitating low back pain for 8 months after he injured himself lifting a heavy boat from his workplace. And he said he went through workers' comp. He was told to see his primary care doctor, pain management specialist, physical therapist, chiropractor, acupuncturist, and massage therapist. And he went through a lumbar CT, which found that he had spondylolisthesis and a bulging disc at L4, L5. So those doctors made him take painkiller medicines and get epidural injections and do sporadic physical therapy. And then he was given manual adjustments by a chiropractor and acupuncture treatments. But none of these really worked for him. He couldn't stand or walk for more than 3 to 5 minutes and was constantly fearful of pain attacks. And this really impaired his ability to work, so he had to quit his job. So he was referred to 2 orthopedic surgeons who told him that he needed a spinal fusion surgery. And it really freaked him out. He said he heard so many horror stories about back surgeries leading to complications and irreversible disability. So he preferred to seek a more holistic and non-invasive solution to healing his low back pain. But he needed help. He couldn't do it on his own. So he found me and contacted me, and he was committed to doing whatever it takes to recover from his low back pain without surgery. So we worked together for 12 weeks in a very structured way, working on the mindset, nutrition, herbal therapy, core strengthening, and postural alignment to tackle the underlying root causes of his low back pain. And as a result, he has improved so much, remarkably. He used to be overweight when I first met him, but after following my coaching instructions diligently, he dropped about more than 22 pounds of body fat in the 3 months we were working together, which has made him way more energetic and has lessened the burden on his low back. And now he says he can function so much better and has become so much more active again, and he has become so much more happier with the pain relief. And he also found a new great job where he's thriving. And now he does not feel that he needs painkiller medicine, nor does he feel that he needs to go back to the orthopedic surgeon to get back surgery. So he said it was such a lifesaver to be able to recover from his low back pain without getting surgery. And he's happy, like he's just so happy, and it really makes me happy when I see all these successful clients. Okay, so moving on, shift number 4. So back pain is an urgent problem to solve right now. So according to the medical statistics, about 80% of the adult population suffer from poorly treated chronic low back pain, but half of them get back surgeries that lead to unforeseen complications, more pain, and irreversible consequences. So I did a study. I did some research on the financial cost of poorly treated low back pain. I'm just going through a conventional medical system, and this is what I found out. Relying on numerous prescription medications cost about $3,600 to about $10,000 per year. And having to frequently visit pain management specialists for epidural steroid injections or nerve ablation therapies, such procedures, it would cost about $400 to about $600 a visit. And if you were to visit those doctors 4 to 12 times a year, it would cost $1,600 to $7,200 a year. And when you go to see a chiropractic doctor, these doctors can cost anywhere between $100 to $300 per visit. And if you see them 4 to $12 visits a year, that's another $400 to about $3,600 a year. And if you end up getting back surgery, each back surgery can cost anywhere between $20,000 to $50,000. And an average person who gets back surgery usually goes for 2 or 6 revision surgeries because there were all these complications, and it ends up costing about $40,000 to about $300,000 total on surgeries alone. And this doesn't even include the postoperative hospital stays, which is even more cost. And say if you're a professional making more than $100,000 a year, if you have a very debilitating chronic low back pain, then that's going to compromise your ability to work. And so if you have 30 to 40 years of work years that you're not able to work due to your low back pain, that means you're having $3 million to $4 million of lifetime income loss. So ultimately, the total lifetime cost of living with low back pain and not treating it properly is several millions of dollars spent throughout life with no restoration of long-term health and wellness. So this is really huge. But that's just the financial cost. The real cost of poorly treated low back pain is on the quality of life. So since people are significantly disabled, they're unable to hold a job, live with depression, low self-esteem, and the sedentary lifestyle can most likely lead to obesity. And people tend to develop chronic illnesses that come with sedentary lifestyles, such as hypertension, diabetes, congestive heart failure, osteoarthritis, sleep apnea, heart attacks and strokes, and having to rely on walkers or canes or wheelchairs later on. And chronic pain just brings pure unhappiness and misery, which really leads to compromised relationships, a lack of passionate sex with a partner, and missing out on a lot of social events in life and traveling experiences. So it's not just about the money issue, but like the whole quality of life. You know, if you don't have your health, you have nothing in your life. So if you think that your holistic treating of your low back pain is not an urgent issue, you need to think again. The longer you postpone properly treating your low back pain, the more your body will develop muscular imbalances, poor posture, brain patterns of chronic pain, and fibromyalgia that debilitate you even more. And I wanted to reiterate the most common pain med people use long-term to take the edge off the pain are non-steroidal anti-inflammatory drugs, which is ibuprofen, naproxen, Aleve, Advil. And these really damage the kidneys, which can lead to renal failure. So according to the UCSF, University of California, San Francisco Kidney Project statistics in 2014, the cost of kidney failure is having to be on dialysis for the rest of your life, and that means it costs $89,000 per year to be on dialysis just to survive. So, you know, if you're just popping in pills like candy because of your pain and you're thinking that you're going to be okay, you know, you got to realize it's even more than that. So the longer you stay stuck with your low back pain, the more expensive your life becomes, draining money and energy down the toilet, you guys. You understand? So the longer you stay stuck with your low back pain, the more expensive your life becomes, draining money and energy down the toilet. But unfortunately, you can't really rely on medical insurance companies because the medical insurance companies only cover the costs of Band-Aid fixes such as pharmaceuticals, injections, and surgeries. And this is because medical insurance companies have no interest in patients getting healed. They're for profit. So they get the most profit when people are staying chronically ill. So they only cover medical bills that will merely treat the symptoms and keep the patient chronically ill, but not really address the underlying problem. So you need to think outside the box to get the real help you need for true healing and be your own advocate. So this leads to the shift number 5, which is invest in mentoring. So the 5 reasons why you're still suffering from low back pain is probably one or more of the following reasons. Number 1, you have not tackled the underlying cause of your low back pain. Number 2, you did not undergo a comprehensive approach. Number 3, you lacked consistency. Number 4, you thought you were doing the right things, but you were doing it wrong because you have blind spots. Number 5, you succumb to negativity. So the biggest complaint I hear from my clients who come to me is like in this picture. They feel like they're just part of an assembly line at the doctor's office, physical therapist's office, and chiropractor's office. They feel like they're just treated like a number waiting in line among other patients, and then having a brief encounter with a doctor, therapist, or chiropractor, and then they get shoved out of the office with a prescription for pain meds and a little bit of ice pack. And then off they're on their own in the cold, clueless about what to do about their low back pain without proper personal follow-up care. So they always feel lost in that impersonal medical care system. So the factors for a successful outcome can be simplified into this diagram. So first, you need a comprehensive approach, tackling all 6 underlying root causes of low back pain, and you have to do it consistently for at least 12 weeks. In order to do that well, you'll have to have a mentor who can keep you accountable. And when you have all this together, you will have a successful outcome. And the reason why working with other healers didn't bring the outcomes you wanted is because they lacked any of these components. So like a lot of people say, well, I worked with a chiropractor and I did yoga and I did physical therapy, but I'm still in a lot of pain. I got worse, and it's because those healers didn't really tackle all these components for a successful outcome. And we live in an age where there's so much free information out there on the internet and YouTube. But for true healing, you don't need more information. You really need, what you really need is a clear step-by-step plan that you can implement right away towards a transformation. So don't try to do it on your own. Without investing in mentoring, you can spend your whole life spinning your wheels, suffering and wasting time and money on things that don't work, feeling frustrated and missing out on real life. I can't emphasize enough the power of the importance of having a good mentor. A mentor can expand your vision of what is possible and push you through fear, disbelief, and overwhelm and laziness. And a great mentor will give you crystal clarity about the next step. So instead of swimming in an ocean of free information, they give you crystal clarity about what to do right now, so you can just silence all the noise. And a great mentor will give you accountability to help you with consistent implementation of healthy habits the right way by making you have skin in the game. And a great mentor will give you a positive mindset, encouragement to maintain hope that you will heal in the midst of all the negative opinions of others. A great mentor can point out things that you have been doing wrong and help you get results safely, effectively, and efficiently. So I wanted to remind you, Paula, Ron, and Fred, they were not able to do it on their own for months and for years. It was only when they found a mentor that they were able to get the proper guidance and was finally able to end the frustration and reach their full healing potential. So it's so important to have a great health mentor. So this is how I want you to select your mentor. You want to invest in the best mentor who has gone through the best relevant medical training and personal healing experience. So find someone who has been in your shoes before and is getting the exact results you want, so that mentor can really understand what you're going through and have empathy. And find someone who has clients with the same great results. And you want to invest in a mentor who guides you through a step-by-step comprehensive approach to holistically healing your low back pain. And invest in a mentor who will give you accountability for consistent implementation of healthy lifestyle habits. And you want to invest in a mentor to help speed up your recovery process and save years of your life. So this helps you save unnecessary costs costs on pain pills, doctor visits, and hospital stays. So overall, I want to recap how to win and get the healing you want. You want to shift your mindset about your chronic low back pain. So understand that it's not a permanent condition and that your body is designed to heal itself. Shift number 2 is you have to shift your mindset about the healing process, understanding that the healing involves an active process, not a passive process. Number 3, you need to understand the core problem of low back pain and stop applying Band-Aids and start focusing on eliminating the roots of the problem comprehensively. And number four, you need to understand the urgency of solving the chronic low back pain problem right now, and you need to understand the fatal consequences of not doing it properly. And finally, you need to invest in a great mentor to make this happen. So now you have a choice. You can take this information and forget all about it and go back to your old life doing the same thing, going to the same doctors who merely give you band-aids and maybe get back surgery and stay stuck exactly where you are, suffering from pain and staying struggling for the next 5 to 10, 20 years, wasting more time, money, and energy on costly pills, procedures that don't help, muscling your way through life. And then maybe get worse until you gain more weight and get all the comorbid chronic illness conditions and suffer even more from heart attacks or strokes and end up on a walker or wheelchair feeling sorry for yourself, or end up in the hospital in a critical condition from all the complications from the side effects of taking toxic pain meds. Or you can get proper guidance towards a holistic healing with grace and be able to wean off of medications, procedures, and never have to have back surgery because you don't need it anymore, and be able to enjoy a pain-free active life with so much vitality long term. So this is how I can help. I have set aside some time in the next 48 hours to talk to you personally about how you can apply these ideas to your health starting today on a breakthrough call. And the cost of the breakthrough call is absolutely free. But here's the catch. This is not for everyone. This is for you if you are a high-achieving professional suffering from a debilitating chronic low back pain, and you have not had back surgery yet and want to avoid having back surgery by all means. And you need to want to fix your underlying low back problem right now as your top priority. And you must be absolutely fed up with the conventional medicine focused on Band-Aid fixes. You must be very coachable and be disciplined action taker. So you must be ready to implement whatever I tell you to do without debating. And you must be willing to invest time and money in improving your health because you need skin in the game in order to really take action and carry on until you get the results. You must be committed to achieving a healthy, fully active life. So you need to be a high-functioning, high-achieving individual having high standards for your life. So this is how the breakthrough call works. It's a call for 45 minutes. It's not a consultation because I'm not allowed to give medical advice to people who are not my clients, but I will be asking you a series of questions to assess if you're a good fit to work with me. And after the call, if we think you're a good fit to the program, we may invite you in. And I do this because I love giving back and I love helping other solution-oriented people who are suffering from low back pain achieve their health goals. And plus, I know that you might want my help to transform your health. And if so, we can discuss and see if it's a good fit for both of us. But if not, that's fine too. But just to be clear up front, this is not for people who have already gone through multiple failed back surgeries and have lots of complications such as scar tissue or dislocated metal hardware. It's not for people who expect an overnight quick fix. Because like I said, it takes at least 12 weeks of consistent implementation of healthy lifestyle to see the results. It's not for people insisting on staying on Band-Aid methods, such as pain pills, procedures, medical marijuana, CBD oil, or surgery. It's not for people who are only seeking free information. It's not for people who are stuck in a victim mentality. And it's not for people who just want to settle for a life of disability. You have to have a strong desire to want to get back into a healthy, active life and have high standards for your life. So finally, I'm showing you this picture because it teaches us how powerful our choices today can dictate our future. Both of these women are 74, but the kind of health and quality of life is totally up to the choices they made earlier in their life. And it's the worst thing coming to the end of your life having regrets due to the wrong choices you made earlier, that you could have been happier, healthier, that you could have traveled more. So finally, in order to book a breakthrough call with me, go to healinglowbackpain.com/apply. Again, it's healinglowbackpain.com/apply. So when you click that link, you will be taken to a calendar page and available times to get on a call with me. So just grab the best time for you and schedule a call, then fill out a short application form and click the submit button. I will get back to you with a confirmation email to remind you about the call. And then I will email you a pre-call questionnaire for you to answer thoroughly and reply back to me. So I need that questionnaire to be returned to me so I can have a good idea about your health status before we get on the call together. So please check your email inbox to find this email. And when I've received your pre-call questionnaire, then I will send you a link to the Zoom meeting where we will conduct our call. So this will be the best 45 minutes you will ever spend to talk about your health issues and have the opportunity to change your life for the better. So I hope that you sign up right now. Spaces are very limited, so I hope that you go and book a call right now, and I will speak with you very, very soon. So thank you again for staying until the end of this presentation. It's been an honor and pleasure to share this information with you. So we'll talk soon. Bye-bye.